Hey, what's up,
What are
Mama?
signs and symptoms of high and low blood sugar?
Oh, okay. Well, you have to remember this. Blood sugar level should be anywhere between 70 to 110, depending on what book you read. But anything less than 70 is considered hypoglycemia or low blood sugar. Anything above 110 is technically considered hyper. But we're really concerned about levels that are above 150, because anything below 150, generally speaking, your blood vessels and nerves won't have any damage. But when it comes to the signs and symptoms, so think of it like this. When you have hyperglycemia, your body has an inability to lower it. And so all the sugar is in the bloodstream. Well, what your body does is it pulls water from the cells, which a healthy person is not supposed to do that. And as it pulls water from the intracellular compartments into the intravascular compartments, you're increasing the fluid that's in the vessels, which now your kidneys are filtering more water, hence they're peeing more. So that's the first sign and symptom of hyperglycemia, of polyuria, increased blood sugar levels. Another symptom, since your body's getting rid of all that fluid that's not supposed to be disturbed inside your cells, your body's dehydrated. So then you have a lot of thirst, polydipsia. And then the third sign and symptom of hyperglycemia is, well, the cells are not receiving any sugar because there's not enough insulin or because there's insulin resistance. And so the cells are essentially starving. And so that's why you're really hungry as well, and that causes polyphagia. So those are the three main signs and symptoms of hyperglycemia. It's going to be your three P's, your polyuria, polydipsia, and polyphagia. But on top of that, the patient's going to be dehydrated. So tachycardia might develop. You might have an altered level of consciousness. The patient may also develop high temperatures because there's not enough fluids in the body to thermoregulate. And those are just basic signs and symptoms of hyperglycemia. Now, when it comes to hypoglycemia, that's a little bit different because this happens really fast. Your blood sugar drops below 70. You start needing energy, but you don't have enough energy, right? Sugar provides energy for your cells, but if you have hypoglycemia, you don't have enough energy. So your body activates another system. This is your fight or flight mechanism or your sympathetic nervous system. And that gives you tachycardia, palpitations, that gives you tremors or shakiness, nervousness, cold, clammy skin, altered level of consciousness, headaches as well. And in a nutshell, guys, that's the main difference between your signs and symptoms of hyper and hypoglycemia.
All right, thanks,
No
Dada.
problem, Mama.